Mr. Connolly is going to talk with us about the importance of 5G in a lot of different contexts, but he's going to really focus in on the ways in which it's vital to health and healthcare now and in particular in the future. I'm going to read his impressive bio word for word because it's as I say, very impressive, and I don't want to miss anything. But before I do that, Azizi, I'd love for you to just give an overview of who we are and what we're doing.
Sure. Thank you so much, Dr. Maloney. Welcome to you all. My name is Dr. Azizi Seixas. I am the interim chair for the Department of Informatics and Health Data Science at the University of Miami Miller School of Medicine. And again, I am so delighted to invite you to be part of another installation of our Future of Health Data Innovation webinar series. We started these last year. And man, we have done extremely well based on your own attendance, as well as based on your own feedback and the caliber of folks that we have brought here. I am so delighted to have Dr. Maloney to lead this effort. And this is really part of the larger vision of really transforming and reimagining academic medicine across 5 areas: education, research, clinical care, venture, and service outreach policy and ethics. We believe that during these times of disruption, that this is when disruptors thrive. And our job as an academic department is to bring to you some of the most cutting edge technology and information so that you will learn how it could potentially impact your work and how you could align with it to augment your work. And so with that, I want you all to consider our department as a home or a home away from home. And so I turn it back over to our phenomenal faculty member, Dr. Maloney, who leads our education vertical. And I welcome Mr. Connolly, who is a very dear colleague and friend doing some incredible work. So I know we're in for a treat today. Thank you for joining us.
Thank you so much, Dr. Seixas. And indeed, Mr. Conley is such a friend to the department. We're so lucky to have him. Okay, so Karl Connolly serves as Chief Technology Officer at Cell Hub, bringing over 25 years in technology innovation and legal expertise to enterprise digital transformation initiatives. He earned his Bachelor of Science degree with a biomedical concentration from Bridgewater State University and was awarded 2 U.S. patents. This man has patents, y'all, for his innovations in software engineering during his 17-year tenure at EMC Corporation. Following the completion of his Doctor of Law degree in 2014 and subsequent legal practice, Mr. Connolly assumed the role of Chief Technologist at Ingram Micro. In this position, he led the architectural design and deployment of sophisticated enterprise IT solutions. His entrepreneurial vision led to the founding of NetMaven in 2024, a specialized 5G consultancy that was later strategically acquired by CellHub, a primary T-Mobile agency. In his current role as CTO of CellHub, Mr. Connolly provides executive oversight for strategic technology initiatives, with particular emphasis on channel partner enablement, enterprise cellular solution architecture, and 5G integration consulting. His strategic leadership advances innovative connectivity solutions across enterprise IT ecosystems, empowering organizations to optimize operational efficiency and technological capabilities. CellHub partners with organizations across diverse vertical markets, specializing in healthcare, which we'll hear more about today, infrastructure transformation through the implementation of 5G technologies that enable secure, real-time collaboration and communications. Wow. So, Carl, I'm going to let you take it away, please.
Great. Thank you so much, Mairead. And thank you, Azizi, for the fabulous introduction and the opportunity to speak to the audience today. So let me jump in by sharing slides. We're going to be talking about 5G today. And I know for many of you, you have that on your phone already. However, you may not be familiar with it in the context of enterprises. And so that's what we're going to focus on today. I'm going to start the conversation with the basics, because I never assume that folks understand why 5G is very different from all the other Gs. From there, we're going to talk about some of the innovation in 5G that I think will probably resonate with you all, specifically in the healthcare field. And then I'm going to give you a real world example of how 5G has dramatically impacted a children's hospital in Boston and now is serving as a blueprint for other hospitals and healthcare centers across the US. And then towards the end, I'm going to just summarize everything up with some of the main benefits that we see day in, day out with healthcare providers and also patients. Because at the end of the day, we're all in healthcare, touching healthcare to impact patient outcomes. So with that said, let me just jump in. As Mairead said, I'm the CTO of a company called CellHub, and CellHub is what's called in the cellular world as a primary agency. And a primary agency's job is really to evangelize technology from a carrier, in this case T-Mobile, and educate, train, and enable partners, managed service providers, global system integrators, and OEMs, such that they can take that technology and benefit and impart that then to subscribers. In this case, that would be you and me in our personal capacities. So before I get into the conversation around 5G, I just wanted to set the stage a little bit and share with you some perspectives as to what I see in the conversations that I have. And I'm fortunate enough, although I touch healthcare, I also touch all the other verticals. And so there's a concerted sort of commonality in a lot of challenges that I see. But in healthcare, because of the digitalization that's happening, healthcare is really ripe for transformation. And if you've been to any of the major conferences like Chime or HIMSS, you would just see that it looks like a technology show today. There's just so much technology impacting the clinical workflows that we see day in, day out. First and foremost, I see a continuing trend in virtual and remote care, and I'll certainly touch on some of the challenges there and how 5G as a platform is enabling that. I think during COVID, many healthcare providers were really scrambling to implement virtual care, and now it's become part of the norm, and in fact is starting to grow. And this means, delivering care to the patient where they reside, which brings many benefits, but also seniors, which also is a very important part of the population, obviously. One of the big challenges and one of the big opportunities is the ongoing digitalization of electronic health records. Started many years ago. Now Epic and Cerner are very dominant. About 96% of hospitals are employing digital health record systems, which is fantastic. However, as great as it is, it also has some challenges, which we'll touch on during the course of the presentation as we go. A huge trend afoot is patient enablement. And this is actually where patients now become part of their own care continuum. And this is done through the likes of wearables, right? So small, inconspicuous devices that are always connected and always collecting important metrics about that patient. And if you think about the ultimate goal, I think, is always to prevent something before it happens. Now with data and analytics and connectivity, that's becoming much more of a reality. This wouldn't be a conversation about technology if I didn't talk about AI and machine learning. I think every enterprise, every vertical market is embracing it. But I think the potential in healthcare is just absolutely huge. Now, obviously, it's not easy and it's complex, but we're already seeing some amazing use cases, such as radiology, imaging, being able to use AI to be almost like a co-pilot or a second set of eyes for a radiologist and make informed decisions. Or oftentimes, look at that image, not in the abstract, but all of the other images that that patient has, and then provide guidance to the caregiver. I think that's very incredible now. Oftentimes we're seeing now ambient listening as the first soiree into AI for hospitals, where doctors now can spend a lot more time in front of their patient and less time in front of the keyboard, because there's ambient listening happening to the conversation. It's taking that conversation, distilling it down, and then putting it into the AHR. And that's freeing up doctors' critical time. Personalized medicine, obviously, we're at the just the onset of that, whereby if you think about it, AI can comb massive amounts of a patient's records, different disparate records, and make informed not decisions, but give the doctors and nurses information about that patient that probably would have been missed otherwise. And one of the things I'm involved with is a project around decentralized trials. And this is very important. in clinical trials, as probably folks on the call will appreciate, compliance is a big problem. Keeping that trial participant engaged is a real problem. And so if you can use AI to identify the right set of participants in a trial, the likelihood of success from the onset is increased. And I was on a panel about 6 weeks ago in New York around this clinical trial, decentralized clinical trial. And in the room, there were a lot of hospitals. And it was very interesting to see that a lot of hospitals now are trying to implement hospital at home. Allegedly, the costs are significantly less, but the patient outcomes are increasingly higher when a patient is treated at home. And of course, it has a lot of tangential and incremental benefits to the caregivers, which are oftentimes the family members, because they don't have to travel or shuffle around their schedules to make appointments to take care of their loved one. So these are sort of the macro trends that we're seeing. But there are also a lot of impediments to them in terms of, if you think about the common denominator in all digitalization, all connectivity between devices and data, it's the network, right? I'm sure you've experienced this yourself on your own personal phone. The phone is amazing. An iPhone, an Android phone, full of great applications that bring joy and capabilities to your life. But as soon as you're out of range of the network, that becomes an expensive brick in your pocket, right? It becomes a pain almost to be carrying around. It's useless because all of those apps are reliant on things that are running somewhere else, primarily not on the phone, but needing data and connectivity. And so the same is true in healthcare. All of those use cases that I talked about, a common denominator within them is the need for a reliable, ubiquitous, secure network. And that's really where 5G has come into its own. 5G has been around since 2019, thereabouts, when it was first commercially launched in the US. And unlike all the other Gs that have come before, it's dramatically different in a couple of different ways. Needless to say, the performance and the capability of any next generation technology is always better than the last. But 5G is dramatically better. Now, you probably don't realize this walking around accessing YouTube or different apps on your phone. The connectivity and the speed was pretty good with 4G. But with 5G, that's increased dramatically. And I'm going to talk less about pure connectivity from a device perspective, but more at the enterprise level as to what 5G can bring. Now, let's look at some of the attributes of the increases. There's a 10x decrease in latency. And this is very important today, especially in clinical communications, where you need instantaneous response. Or if you think about now things like remote surgery machines, they need millisecond accuracy, millisecond response time. So when you send a signal and get it back, that's what's known as latency. And now at 5G, you can get sub 5 millisecond latency, which is amazing. That's like faster than the blink of an eye. 10x, 100x traffic capacity. 5G networks are much more efficient and can support much greater volume of data. And that's very important, obviously, today with ongoing digitalization. You want to be sure, if you're making a choice around a network, that you build a network that will support increased capacity requirements. Efficiency is very important as well. Obviously, with global warming and concerns of ongoing power utilization, deploying these networks at scale has a huge burden on power. And people don't often think about that, or oftentimes thinking about the devices, right? Devices need batteries. And if you want to support remote patient monitoring and the like, you'd want to make sure that you have a network that's not sucking a lot of juice out of the device, but being able to support a small device with a battery for many years, perhaps, before it is actually needed to be replaced. And so in 5G, the 5G network is 100 times more efficient than 4G networks, and that's good news for the planet. And another great feature of 5G is the connection density. These standards, and there's an international governing board called the 3GPP that defines what goes into 5G. And in the standard, it says 5G must support 1 million devices in a square kilometer before there's any degradation of signal. So you can see there's massive technology improvements and attribute improvements in 5G, which makes it the perfect platform for healthcare, in my opinion. One of the things that a lot of people probably won't realize is that 5G is very much like a modern software application in the way it's designed. I know you probably don't realize that when you think it's just a signal you're getting on your phone. But that 3GPP organization that I mentioned are basically the architects of what goes into 5G. And so every couple of years, as you can see along the bottom here, release 15, 16, 17, 18, and 19, there are improvements that are brought into the network in terms of features and functions. And that's great news for us as consumers. And I'll touch on one of the big features that's just been released in release 18, which is where we're at today. So we started with 15, 16, 17, and now we're at 18. And in 18, something that came in, it was the support of non-terrestrial networks. Fancy word for saying connectivity from a satellite versus a cell tower. And I'll touch on that in a minute and why it's so important, specifically in healthcare. But there are other enhancements to the network now that this release 18 brings, specifically a lot more reliance on AI and machine learning to make the network almost self-healing. So that's great. Imagine the software can actually interpret the traffic on the network and allocate resources on the fly such that the network becomes more efficient and can scale and can self-heal when issues arise. So that's very important in terms of reliability. We're also seeing enhancements in radio technology, the beamer of the signal, if you will, to make it more efficient, to make sure that handoffs happen better. And that's great, especially for objects that are moving at speed. And then one of the features that is built into this release is reduced capacity. And this becomes important in remote patient monitoring, like I mentioned. This is the ability to leverage devices with specific access to spectrum that use very low power. And that becomes very important, as I mentioned, in devices that don't would ordinarily need a lot of battery replacement or charging. These are now devices that can be basically set and forget. Within 5G, in addition to the improvements in the architecture, there are also different bands of spectrum. So there's low band, mid band, and high band, and all the carriers aggregate these bands and offer them as their 5G service. It's important just to realize that each band has its own attributes and its own set of capabilities. The mid band, though, here in the middle, really has the right set of coverage, capacity, and latency, and it's oftentimes called the Goldilocks band. So from our perspective, and the reason we aligned to T-Mobile specifically is not only because of their architecture, but also because they are the carrier in the US with the most mid-band holdings. And when you're talking to an enterprise and you're trying to figure out solutions that leverage 5G, you want to be sure that you have the right set of spectrum to offer them in the offering. Now, the interesting thing about 5G, and we're going to touch on this more in the context of healthcare in just a second, is the fact that because it's a software-defined construct, when 6G comes in 2030, it'll be a relatively smooth transition. But just know there are a lot of capabilities that are being rolled into 5G that will really have a material impact as time evolves for healthcare. Now, touched on T-Mobile just briefly. One of the main reasons that I wanted to share with you that we're a primary agent just for T-Mobile, and you may not realize this, is that they have the most mid-band holdings in the US. And this became very important in the Boston Children's Hospital example, which I'll touch on in a second. But the most mid-band spectrum holdings means that they can do some amazing things in terms of range, coverage, capacity. They also have a relationship with Starlink. So I touched on satellites there a few minutes ago. They have, with Starlink, deployed 500 low Earth orbit satellites, which means that imagine you've got patients in a remote community. The only way that they could probably get care is if they got in their car and drove to the hospital. Because there was no internet connection or very poor internet connection such that it couldn't support a telehealth or a video conference session. That's going to be a thing of the past, and that's really good news for us all. If you can see the sky, you're going to have connectivity, and that's the future with 5G. In addition, T-Mobile has a very differentiated architecture. It's called standalone, which means that it's built from the ground up with no reliance on 4G. The other carriers right now have what's called non-standalone, which means that they're reliant on legacy 4G. And that becomes very important when you want to look at innovative solutions that are available for healthcare. T-Mobile announced 2 solutions that are using what's called a network slice. And we'll touch on this in more detail in a few minutes. But network slices enable a carrier to basically create virtual networks off of their primary network for specific uses or groups. So for example, T-Mobile announced last year a security slice, and this becomes very important in hospitals and healthcare, specifically where there are a lot of different devices that are cellular connected. And those devices are so small that they don't have a complex operating system. Think like an infusion pump or something like that. But if you're a hacker or a sophisticated cyber criminal, you could potentially get into that device and then get into the network. And we've all heard the horror stories about ransomware that are affecting healthcare. Absolutely atrocious. And these bad actors have no qualms about going after a hospital and shutting it down. So with the secure slice, these devices can take advantage of security that's actually built into the network. So they don't need a sophisticated operating system. They don't need security software running on the device itself. It's basically running in the network where the data from that device gets kind of encapsulated and then routed, not over the internet, which is very important, but through T-Mobile's network into the corporate data center or the hospital itself. So that means it's isolated and insulated. That's very important. Another thing, if you're watching the T-Mobile commercials, they're talking about T-Priority, which is a offering for first responders. So doctors, nurses, clinicians, ambulance drivers, police, any first responders. Typically when there's a mass event, networks get saturated. Everybody's on their cell phone, people checking on each other, doctors trying to communicate, nurses trying to communicate, hospitals and ambulances trying to be in communication in real time. And when the network's saturated like that, it puts lives at risk. With T-Mobile Priority, T-Mobile's basically dedicated a slice of their network for specific subscribers. So first responders have priority and preemption, but they also get this specific slice. And because they have that standalone architecture, they're the only carriers that can do that. And this becomes very important as we start to look in the future for hospitals, because hospitals have very specific requirements around bandwidth, reliability, security, and latency. And now a hospital, for example, and we'll give you an example in a second as to what we've done, can engage with T-Mobile, for example, and bring their specific requirements from a networking perspective to them. And they can essentially carve out a slice that is dedicated and customized for that specific end user group or organization, which is a game changer. Now I'm going to pivot a little bit into some of the challenges that we see in healthcare with respect to legacy networks and why 5G is potentially a game changer and why many organizations are getting interested. Well, I think it goes without saying, in a hospital, every single second counts, right? Communication and collaboration challenges are everywhere. But in a hospital, because of the structure, if the impediments, like in the basement, you're probably going to have radiology images, right? You've got a lot of concrete, a lot of glass, a lot of thick walls. Signal typically can't get in there, and therefore communication and collaboration is a real challenge. And specifically, obviously today, with the speed at which decisions have to be made, triage happens everywhere. And so dead spots are a real problem, and that just adds to the stress of clinicians. Part of the challenge too with legacy systems is the lack of EHR optimization. And that's one thing we very much focus on. We look at clinical workflows, we look at the devices, we look at the applications, and we develop strategies that are optimized to get the best return on investment for an EHR. Big challenge in communications too is alarm fatigue. You've got doctors and nurses carrying multiple devices and multiple alarms are going off. You know, it's very hard to separate the forest from the trees and know which alarms should get through and which ones should get addressed. And that's a big problem. And then obviously interoperability issues. A lot of legacy devices out there are not modern enough to take advantage of all the features and capabilities of a modern digital communication system. So really, there's a lot of challenges in healthcare specifically because of a lot of legacy technology and lack of budget. And so today, when you think about communications and collaborations, there are two basic routes you can go. And the traditional route has always been Wi-Fi. And Wi-Fi has definitely its own merits. Don't get me wrong. I'm not here to tell you Wi-Fi is bad. But when you think about Wi-Fi and what it was designed to do, it was never really designed for mobility. And so Wi-Fi has obviously limited signal strength. Whenever you're beyond the range of the access point, the signal's going to drop. And that's a big challenge, obviously, in healthcare, where you have to be always on, always connected, and always in communication. One of the other issues with Wi-Fi is it doesn't support massive amount of bandwidth, and that's the challenge. We see, for example, we go into hospitals and you've got patients, family members coming in at lunchtime, and they want to use the guest network because the cellular coverage is terrible, and it floods that network. And that's to the detriment of potentially critical communications. And so that becomes a real challenge. Bring your own device security. That can be a challenge with Wi-Fi. Wi-Fi is inherently risky. And so specifically at remote patient systems and remote patient care, that data traverses the internet and it can never be truly secure. And then, of course, as I mentioned, the big challenge is no mobility. Wi-Fi was not really designed for mobility, and you probably experienced this yourself. Even in a major hospital where they have lots of access points, there's typically spots where your handoff is impeding your communications. And so that's why we position 5G in hospitals as a better solution to Wi-Fi. Not a complete replacement, but an improvement, if you will. It has superior signal strength, so it can cover a great distance. It has higher bandwidth, so the likelihood of the network being saturated is incredibly low. Native security. One of the things in 5G that the 3GPP, that body that I told you about, that architected the standards, they really built security into the standard from the get-go. So intrinsically, it's a much more secure protocol. But then because of the other features, like I mentioned, the slicing and the like, you're basically able to micro-segmentate or ring fence certain aspects of your network and employ zero trust type protocols. And last but not least, I think it goes without saying, cellular technology was designed for mobility. The phone cellular networks were designed always with the mindset that the target is moving, the person is going to be moving. And obviously, in a very dynamic modern environment where people are accessing data and resources and services on the cloud, they're mobile. And so that's why 5G is a really good option when you're contemplating transformation in your hospital or facility at scale. And the way that T-Mobile does this and the way we help healthcare customers is with a solution called Advanced Network Solutions. And this is basically a customized version of the public network for the enterprise or the hospital's own use. Pretty cool, right? I mean, this is where we're at these days with 5G. It's amazing. So the engagement happens where the engineering team from T-Mobile will do what's called an RF assessment, or radio frequency assessment. And this is really cool in the sense that it builds a 3D heat map of your existing connectivity. And it identifies where the gaps are, where the dead spots are. And then a solution is engineered such that we can get around those impediments and ensure that there's 100% coverage. And in the example I'll talk about in a few minutes, there was a need at that specific hospital for coverage in the basement, in the elevator shaft, and even on the roof and out in the car park. So with Wi-Fi, that's just not possible. So with the ANS solution, you can basically get that customized version of the macro network for the hospital's own use. And this has huge benefits. Needless to say, the data, which is so dominant today, has a faster transmission rate over 5G. So larger files can be downloaded and seamless. And that's great. No spinning wheel of death with 5G. You'll also get enhanced mobile access. And this is obviously the ability on a mobile device anywhere to access that data. And when it comes to patient decisions, these can be made obviously in real time and on the fly. And that's very, very important. But the reliability is the big ticket item in healthcare, right? A network must be reliable. If it's not reliable, people die. And that's just a fact. And so T-Mobile's architecture and 5G intrinsically is incredibly resilient. And they have what's called a distributed core, which means that the services can be served up from multiple different data centers. So God forbid a data center goes down, there's others that just step in the shoes of the one that would go out. And in terms of towers, they triangulate across multiple different towers. And as I mentioned to you now, there's a move to shift to satellite as well. So you're getting all of this capability which ultimately translates to reliability, which at the end of the day is focused on delivering a better patient outcome. And then, of course, we're not ignorant to the fact that any technology change or new technology costs money, okay? Yeah, that's a fact of life. And while 5G enables a hospital, for example, to really future-proof the network. So what do I mean by that? Once a 5G network goes in, it solves for the communication and collaboration issues within the hospital. But it doesn't stop there. Those networks have such bandwidth and such capability that now use cases that heretofore just weren't possible, like the AI ambient listening, or the smart hospital rooms, or the remote patient care, or extending the services of the hospital beyond the four walls, are now a reality because you've made an investment in a network that can deliver that kind of capability. And that's a good return on the investment. At the end of the day, what we're really focused on in our team is really redefining reliability, providing unconditional connectivity. It sounds very esoteric, but it's the result of this kind of capability in this network, right? So we're looking for always on, reliable, scalable, and secure with a human-centric design. Okay, the technology shouldn't lead, it should be an enabler. We shouldn't be trying to find a solution for technology that we have. We should be finding a problem and solving with an outcome-driven approach. And that's how we work. We look across the hospital, we look at all the challenges that they have, we look at the technology they have, they look at the application they have, and more importantly, we look at the clinical workflow. How are the doctors and nurses going about their day to day? How are they interacting with patients? How can this be optimized? And how potentially could a network with better capabilities deliver outcomes that are increase the patient outcomes, but also give doctors and nurses and support staff a better sense of themselves and how to do their job. So we really look at supporting inside and outside the hospital, and this is very important. A network just shouldn't be within the four walls and that's it. It should have the ability today to extend out. Doctors and nurses and clinicians, and I'm sure I'm preaching to the choir here, you're oftentimes on the road or at conferences, and life doesn't stop. You need to be connected and you need to have access to the files and the data and the applications and the updates and maybe issuing orders from a remote. And so the network should support that. Obviously, inside the building, we need to integrate people and process. Single device is very important today, right? Eliminating multiple devices and all that churn and that cost. Integrating into the workflow that I mentioned is incredibly critical. And ensuring that alerts are appropriate. And then bringing together new technologies like ambient listening, as I mentioned, and AI-driven clinical workflows to smoothen out the experience for the staff. And then obviously care at home. A lot of organizations that I talk to are trying to figure that out. They want to treat those patients out where they live and ensure that they get a good return. So let me just explain to you really quickly an example that we did in Boston, Boston Children's Hospital, where the hospital wanted to take advantage of 5G for a bunch of issues that I'll talk about in a second. But essentially what T-Mobile is able to do is carve out a slice of their network. Let's call it an APN today. And I've put on the diagram, it's APN 10. So inside the hospital, all of the devices that are configured to access APN 10 means that the communications, collaborations, the data is isolated and secured within the hospital environment. However, the reality is, as I mentioned to you, doctors, nurses, clinicians, they travel and they need to have access to their data. So the hybrid network approach, rather than just a pure private network, enables the ability for T-Mobile to basically broadcast that private APN on all of its towers across the US. So if you're in Miami or New York or Denver or Los Angeles, you have access to that APN because you have a device that's configured to see it, but only devices that are configured to see it. And that's amazing because it really gives the clinicians and the doctors and the nurses and support staff the ability to work from anywhere and really do their jobs in a secure, reliable manner over the network. And that's a game changer. And that's the kind of technology we're employing today. The example that I alluded to is Boston Children's Hospital. We did this about 2 years ago, where Boston Children's were undergoing a lot of transformation under a new CIO, Heather Nelson, who had a vision for the hospital. And the vision started with implementing a new EHR, electronic health record system, which was Epic. And so the hospital faced a lot of challenges. they needed to implement a modern clinical mobility platform. Communications and collaborations were poor. They needed to support both in-building and remote building, as I mentioned to you. The EHR itself was driving a lot of digitalization and also the need for mobility. And so they knew that they had a big challenge there with their existing network. They needed to secure they needed a secure network that would cover 3 million square feet, which is their primary campus, but they also had a secondary campus that they wanted to ensure had coverage. They also needed to streamline device management. They had a lot of different devices, pagers, and multiple different phones and different tablets and stuff that they wanted to get rid of and unify as much as possible. And they wanted to upgrade the DAS, digital antenna system, such that anybody in the hospital that came in, any visitor, would have a better experience on their cellular phone. And last but not least, they had made an investment in Wi-Fi, so they wanted to ensure that they got a good return on their investment. And so when we came in with a partner in T-Mobile, we architected a solution that addressed all that. And that's what 5G can do. We brought in a private network or a hybrid network to give them the coverage and capacity that they needed in building, but also, as I illustrated to you, give them coverage for roaming doctors and nurses. We also standardized on a single device, an iOS device that was simple to manage, had all the applications that they needed, and gave them the security that they required. But they also were able to offload their Wi-Fi. So that existing Wi-Fi network that was so saturated, all the mission critical transactions now were moved over to 5G, and that actually gave Wi-Fi a boost. So with mobile solutions today, we're starting to see a lot more requirements around a single mobile device with different applications that have access to EHR. It's giving enhanced connectivity, improved clinical outputs, efficient data sharing, which is very important. And as I mentioned, the future of this is really in-home patient care, AI-based prioritization, and advanced medical workflow. Remote patient monitoring, I touched on this very briefly. I know in the essence of time, I want to speed up, so we have some time for questions if we need it, but we're seeing a huge focus on this. We can help by building kits for remote patient monitoring, whereby specific devices can be sent out to a patient, and that patient can then participate in their own care. I mentioned senior care. This is an area we're really focused on at the moment. Obviously, the population is aging in the US, as is it around the world, but here specifically, and a lot of seniors want to age in place. They want to live a more productive life in their home or in a care facility. And so we've built a device kit that has a lot of capabilities that are cellular enabled, so highly secure, highly resilient, but things like virtual companion. Seniors, when they live alone, get very lonely. And now with AI, you can basically create a digital companion to keep them engaged and to almost fill in as a friend. So to wrap things up, folks, just wanted to stress for you, 5G, of course, on our phones, it gives us access to faster YouTube videos and the like. But from an enterprise perspective, think about it as the connective tissue that's really an enabler of all of the amazing innovation that's happening in healthcare. At the end of the day, it all needs a reliable, secure, ubiquitous network that can keep up with the pace of change and that will give you that return on investment. So what we're seeing from doctors, nurses, clinicians, support staff, real-time access anywhere. That's very important, right? To be able to access those records on the go. Enhanced collaboration, the number one issue that we're encountering and we're solving for. Tech takes a backseat. Very, very important. At the end of the day, doctors and nurses are in the business of helping people and not dealing with technology. We want to make sure that we're integrating into the workflow, making the workflow better and giving you more face time with your patients and improved efficiency and job satisfaction. And last but not least, what are the benefits for the patient? Obviously, they have real-time access. That is amazing. Devices being able to alert their caregiver of a situation so they can get care before it becomes something more dangerous. High quality video consultation. This is now possible over 5G. There's no lag, there's no jitter, and there's no latency. Bridging the rural divide. Very important for us is to help those communities that are somewhat isolated, ensure that they can get care, leveraging technology to do good for humanity. And last but not least, the hospital at home is a big trend that we're seeing, as I mentioned, and 5G certainly enables that. And patients get much better outcomes when they're treated at home. Costs go down. And I think it offloads the burden and and cuts down on readmittance rates, which are so very important. So I'll stop there, folks, and leave a couple of minutes for questions if there are any. I'd love to engage with you about any.
Karl, what an amazing talk, and kudos, my friend. I've heard you speak on multiple occasions, and it just seems as if it just gets better.
Thanks.
It's not just prosaic, but also poetic. So really amazing, work. I know there was one question in
Okay.
the chat, but I'll facilitate it because I think since you're on the topic about building and bridging the digital divide, we recently had a paper published in Frontiers Digital Health. Shout out
Yeah.
to our resident technologist Loranda Holliman, who is the first author. Where we focused on the digital divide, not just focused on access and affordability, but we broadened it to include things around adequacy and the like. And that has to do with, a recent, map that was published by Microsoft that, really, disputed what the FCC stated, which only, I believe, stated that only about 25 million individuals in the United States didn't have adequate, broadband. But when Microsoft did their analysis, that it was about 125 million people who actually don't have the minimum download upload speeds of 25 Mbps. So how could 5G address that particular issue, if you could speak about it, particularly since you spoke so eloquently about the digital divide, particularly place-based digital divide?
Yeah, absolutely. So you're spot on. So one of the big challenges, obviously, in rural communities from a carrier perspective, a T-Mobile, Verizon, AT&T, is the economics. Putting a cell tower and infrastructure out there is not inexpensive. And to get a return on the investment, obviously, it makes sense to put them into areas where there's a bigger population. So with the advent of 5G, as I was talking about, specifically now in this release, new things are happening whereby those relationships with Starlink exist. And because of its capability and its coverage, it's literally beaming 5G from satellite to device, irrespective of where the individual is on the planet, essentially, right? And this is a real game changer. And I would argue in the not too distant future, as this becomes less expensive technology to deploy and employ, it's really going to fill in that digital divide and enable communities to participate, patients to get treated, students to seek education, and democratizing access to data that heretofore just wasn't economically or technology feasible. The 5G architecture, I didn't get into it in too much detail, is designed really in microservices, which means that specific services can be sent out at the edge, where it's really an optimized network. And so a carrier can choose to employ certain technologies which are not incredibly costly and yet give the amazing benefits that a macro network can deliver in a populated area, but yet in a rural area. So 5G really, from an architectural perspective, is truly different from the 4G in the sense that it can accommodate that kind of access.
No, this is fantastic. Could you opine a little about the ethics, please, particularly around cost, and I believe Dr. Maloney had asked a question about what does this mean for the environment. So I think you just addressed the issue around how this could be better to reduce these divides, right? These barriers, and it might potentially be cost prohibitive down the road. Can you say a little bit more from a policy standpoint in terms of how the adoption and use of 5G moving forward? And based on your projection, it seems 6G is on its way. How do those new technologies or telecommunication capabilities, whether it be through other forms of extraterrestrial It could be satellite, it could be drone,
Mhm.
it could be a kind of a internet weather balloon in some ways. Can you say a little bit more in terms of the ethics, how that might impact the environment? Because that has always been the knock that we've heard about 5G.
Yeah. Well, as I was mentioning to you, the architecture of 5G is very different. It truly is a software-defined construct. And as you know, anytime something's in software, it can take advantage of new enhancements or new technologies such that it just gets better, it gets leaner. And one of the things with the current release, with that reduced capacity built into reduced capacity from a power consumption perspective, that's going to become a game changer because you're going to have devices that are less power intense, have greater battery life, have longer battery life, are smaller form factor, and in fact, some of them can actually be powered by kinetic energy just through the wearing of them, which is incredible. Now we're just at the onset of this kind of technology, but that in itself is amazing. And then, of course, as I mentioned earlier, the infusion as you see of AI and machine learning now into the network is making networks more intelligent, almost self-aware. It sounds a little scary, but it's actually quite beneficial because you can imagine if a network can anticipate load or look at patterns, it can make informed decisions for deployment, for example. Like I'll need more scale or less scale, or I need to allocate different resources on the fly. So those networks become incredibly lean in terms of their use, power use, and become much more efficient. And I think that's going to become the norm. And you'll start to see this cascade into other areas too, where 5G then through IoT, for example, can impact smart grids and things of that nature. And so the use of data with edge devices and compute becoming such, more powerful, a smaller form factor, it's going to change the landscape to a great extent. And I would argue reduce dramatically the impact from a power consumption perspective.
No, this is fantastic. We have another question from
Mm.
our another superstar, faculty member in our department, Dr.
Mm.
Jun Chung. He's asking if you could describe briefly or explain what are the self-healing networks and what is that characteristic? As I said, Karl, I've heard you
Mm.
speak a lot, but
Yeah.
this was really poetic. So you use the terms self-healing and networks. What does that mean? If you could just say a little bit about that, and then can you
Sure.
talk a little bit about the expected capabilities of 6G?
Yeah, let's talk about self-healing. Self-healing in terms of IT has been a concept that's been around for several years. When I worked at EMC was building machines for data center, data storage. And the trend was that organizations wanted to employ virtualization. So essentially abstract the physical, but provide the same capabilities that the physical infrastructure would provide through virtualization. And that's when self-healing started to come into the lexicon. And self-healing basically means that systems should have failover and resiliency and redundancy built in, but also have a software stack that can realize when there's an issue, or more importantly, before there's an issue, and take action to essentially bypass an outage, because an outage is the worst thing that can possibly happen. And so in the network, what's being built in now, and T-Mobile have a relationship with NVIDIA where they're building a lot of AI and machine learning capability into the network. It's looking for those things. It's looking for anomalies in the network, spikes in usage, for example, or patterns where, even from a cybersecurity perspective, there's something going on in the network that's not normal. The pattern recognition through AI can detect that, and then specific actions can be taken. So, for example, if you're starting to see latency in the network, the software could essentially reroute the traffic to another path in the network. That's what a self-healing network basically means. Identifying an issue, isolating the issue, resolving the issue, and then bringing that issue, that resource back online. And that's the future. And I think that's going to be the future for a lot of different things, not only networks, but physical devices, data devices, storage devices. Things are going to get smarter and become, I won't say self-aware from a philosophical perspective, but aware when there's an issue, such that they can take an action and prevent that outage. From a 6G perspective, Dr. Azizi, to answer your question, I think at the end of the day, the network will become more intelligent. The network consumption from a power will continue to decrease, but the capacity and the bandwidth capabilities over the air will only increase. And that means more capabilities, faster speeds, lower latency, even better than it is today, but become more ubiquitous. Right now with the satellite offering, it's just for data. Soon it'll be for voice. And then it'll become ubiquitous. And maybe at some point there'll be no need for cell towers anymore because the network will be running off of low Earth orbit satellites. So lots of changes. I would just imagine, like all good things in technology, it'll get better, it'll get more efficient, it'll get leaner, and it'll probably become more invisible to us. It'll just be that 5G or 6G devices will become the norm. These devices will be always connected and always on, and every single device will be part of the network and be able to potentially make decisions.
No, this is fantastic. I think we have one additional question, and this is from another attendee.
Okay.
They said, with regards to secure slice, does it support end-to-end encryption? And how manageable is the SAS 5G approach?
Yeah. So yes, it does support encryption. It's end-to-end. Data at risk and data in flight is completely encrypted. Basically, the SAS slice is managed by the carrier, so it's not exposed to the consumer. And for some enterprises, that's a little bit of a challenge because they're so used to big security teams, lots of different tools, lots of different capabilities. However, in this regard, T-Mobile's providing the SAS slice capability, so it's actually running in their network. So it's isolated behind T-Mobile's basically firewall. But from a device perspective, when the data is transferred, it's encapsulated in an IPsec tunnel, encrypted, and then routed through T-Mobile's network into a Versa gateway, the SASE with zero trust protocols, and then into the corporate network. So missing in that equation was the internet. That data never touches the internet. So highly secure, highly scalable, and incredible opportunity, I think, for enterprises. What it means, I think, for us as consumers, and we're starting to see this because it's commercially available, is where organizations have, let's say, a 5G laptop, maybe the University of Miami students, right? Many times they're not thinking about the security in the way that they need to. And so if you have a 5G connected laptop running with the SAS offering, and no software needs to be installed on the end user's device, it's completely invisible. Once they're connected, they're secure, which is really nice because from an IT perspective, it offloads that specific burden from the endpoint. In enterprises, the weakest point is always the endpoint, right? Those mobile devices or laptops. And so if you can offload that burden and alleviate that and deliver it as a service from a best-in-class carrier, I think most IT departments will realize that, much like they are consuming cloud services, this is something they're getting as a service. It's baked in, it's intrinsic to the offering, and it offloads a lot of cost and complexity from their perspective.
Well, this is fantastic. I don't know if we have any additional time, but Karl, this is phenomenal, and I thank you again for such a phenomenal presentation. I also
thank you very much.
thank you, of course. It's amazing. I've learned so much, and you've clarified some areas of gap for my own understanding. So thanks again for a very inspiring, but real glimpse of what the now looks like and where the future will go. And the question that I ask everyone on this call, particularly folks from the U, or if you're in healthcare or you're just a concerned citizen, how are you going to engage and participate in this? And by no means we're not selling anything here. Part of my job
Mhm.
is that in order to, if you want to resist something, that's totally fine, but be more knowledgeable about what you are resisting, because I think there are some benefits. We didn't get too much into the unintended consequences or negative consequences, but something tells me we'll have Karl again to kind of go over that, because maybe what we can do is to extend this into a conversation, Karl, at some
Love to,
point,
love to.
because this
Yeah.
is on our YouTube channel. So again, thank you so much, Karl. Thanks to the team, Dr. Maloney, Miranda, and Dunia, and the entire Media and Innovation Lab and the Department of Informatics and Health Data Science, and the University of Miami. With that, we invite you to come yet again next month in April, where we will have yet again another installment. For those of you, the Media and Innovation Lab and the Department of Informatics will be at next week's Emerge Americas Expo, where we're going to be having a panel on innovation with and for a purpose. And we'll have some of our friends here from, in telecommunications, because we are seriously committed to building the healthcare of the future. And we're trying to bring all the stakeholders together. So with that, Karl, thank you so much again for your time. Thank you,
Thank you.
thank you. And have a wonderful day, folks.
Great. And if anybody wants to connect after, just find me on LinkedIn. I'd love to connect and chat and continue the conversation. Thanks so much.
Excellent. Have a wonderful day, folks. Bye now.
Bye-bye.